What the Study Says.
Welcome back to What the Study Says. I'm Dr. Kai.
And I'm Dr. May. Okay, so you open pretty much any health-conscious person's cupboard, right? And you'll probably find them. Those little golden capsules of fish oil. They've been pushed for years, decades even, as this ultimate preventative shield. Good for everything from your heart to your memory.
But, and this is really the core of our deep dive today, the fish oil that shows real power in clinical trials. It's fundamentally different from that standard bottle you buy at the store. The science is actually pushing us to see these less as, a general supplement,
right,
and more like targeted pharmaceuticals.
Mm-hmm.
They have real drug-like benefits, but also, crucially, drug-like side effects.
And that very distinction, supplement versus actual drug, that's our mission today. We're going to wade through a lot of complex data, sometimes data that even seems to conflict, to really clarify who should take this stuff, who might be at risk, and why the specific type matters so much.
Exactly. So to set the stage, let's just quickly define what we're talking about. Fish oil means omega-3 polyunsaturated fatty acids, or PUFAs. There are three main players: ALA, which is alpha-linolenic acid, EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid.
And ALA, that's the one from plants like flaxseed, canola oil. That one's actually essential. The body needs it. But here's a fact that surprises a lot of people. Our bodies can technically convert ALA into EPA and DHA, the active forms, but it's just, it's really inefficient.
Oh, extremely inefficient. Some sources suggest it's often less than 15% conversion. So, all those people adding flaxseed to smoothies thinking they're getting all the omega-3s they need, they're kind of fighting an uphill biochemical battle internally.
Right. So if you want those high therapeutic levels of EPA and DHA doing work in your system, you basically have to get them directly.
Yes, primarily from fatty fish or these concentrated supplements we'll be discussing.
Okay, so moving from just general diet to actually treating conditions, this is where the evidence gets really sharp, doesn't it? Let's start with the clearest use case, managing blood fats. Where do high-dose omega-3s really shine?
Without a doubt, that's managing hypertriglyceridemia, or HTG. So we're talking elevated triglycerides, either that moderate level, say 200 to 499 milligrams per deciliter, or the very high levels, VHTG, which is 500 or more.
And this is where that pharmaceutical dose really kicks in. What kind of results do we see at that strength?
At prescription strength, which is typically 4 grams per day, these omega-3s give really significant reductions. For standard HTG, you're looking at maybe 20% to 30% lower triglycerides.
Wow.
And for the very high levels, often 30% reduction, sometimes even more. And what's really telling is the dose dependency. If you take less than 2 grams a day, the effect is much, much weaker. That really underscores that it's acting like a targeted drug at that higher dose.
Okay, so here's where things get, complicated. And where the difference between various bottles on the pharmacy shelf becomes absolutely critical. These big recent randomized controlled trials, they've forced us to separate EPA-only products from the ones that combine EPA and DHA.
This distinction is probably the single biggest shift in omega-3 research in the last, say, decade, especially for heart protection. A huge meta-analysis came out in 2021 looking at trials with almost 150,000 people. It confirmed that while omega-3s overall did lower cardiovascular mortality and major adverse cardiovascular events, or MAE, the benefit was definitely not uniform across the board.
So unpack that EPA advantage for us. Why is just one component proving potentially better here?
Well, the analysis showed that the reduction in cardiovascular risk was significantly more pronounced with EPA monotherapy, the EPA-only stuff, compared to the combined EPA plus DHA products. We're talking EPA only showing greater relative drops in CV deaths and non-fatal heart attacks.
But wait, for years the thinking was DHA was crucial, especially for brain health and things like that. Now you're saying for a high-risk heart patient, maybe already on a statin, the DHA part might actually work against the goal at these high doses. That feels like a major reversal.
It really comes down to LDL cholesterol,
Yeah.
The bad cholesterol. When you give high doses of the combined EPA plus DHA products to patients with very high triglycerides, those VHTG folks over 500, the DHA component often pushes their LDL-C up.
Up by how much?
Sometimes significantly, like 15% to even 36% higher. And that's obviously a problem if you're trying to lower overall cardiovascular risk.
Okay, so this is where we need to name names, right? The specific pharmaceutical agent, icosapent ethyl, or IPE, that's the high-purity prescription EPA, only used in that big trial, reduce IT.
Exactly. And IPE did not raise LDL-C in those VHTG patients. It actually led to some modest reductions in other problematic lipoproteins, too. This is precisely why you can't just take the amazing results from Reduce IT and apply them to your standard over-the-counter fish oil bottle that has both EPA and DHA, they behave differently at those doses.
Hold on, though. If DHA is potentially raising LDL in these high-risk patients, why are combined supplements still everywhere? Why wouldn't regulatory bodies step in more forcefully? What's the argument for keeping DHA in some products?
Well, it's partly about the dose and the specific patient. DHA is vital for things like brain and eye development, which we'll touch on. And that LDL spike seems most pronounced in the very high triglyceride group. For someone with moderate HTG or maybe taking a lower non-prescription dose, the combined product might still lower triglycerides without that dramatic LDL jump. But the core message for someone already at high cardiovascular risk, maybe on a statin, needing serious triglyceride lowering, they need to be really careful. An over-the-counter combo might not be their best bet and could even be counterproductive for their LDL goals.
So the cardiovascular takeaway is high-dose prescription EPA only seems the winner for high-risk patients needing triglyceride lowering and heart protection. But now we've established these are acting like drugs. So we absolutely have to talk about the drug-like risks.
Yes, you can't have powerful benefits without considering potential downsides. And the biggest one that's really emerged recently and changed the conversation is a heart rhythm issue. Atrial fibrillation, or AFib.
And this isn't just a theoretical worry, is it? The trial data is pretty solid on this.
Quite clear. Across the major trials, omega-3 supplementation, especially at higher doses, is associated with an increased risk of developing AFib for the first time. The relative risk increase is around 1.26.
So a 26% higher relative risk, that sounds significant, especially if you're taking it for heart protection.
It is significant, and it forces a difficult conversation between doctors and patients. How do you balance that? Well, part of it is understanding it seems very much dose-related.
The dose again.
Always the dose with these compounds. Think of it like other potent medications. A standard dose is therapeutic. A much higher dose can become toxic. With fish oil, it seems like when we push the dose up past maybe 1 or 2 grams to get those big triglyceride benefits, we also cross a threshold where the AFib risk starts to climb noticeably.
So there's a direct link there. More dose, more risk.
That's what a meta-regression analysis suggests. It indicated that for every extra gram of omega-3s per day, between that 1 gram and 4 gram range, the hazard ratio for AFib went up by about 1.11. So yes, the dose giving the biggest heart and lipid benefits also carries the highest AFib risk. Clinically, this means high-dose patients, especially older ones, say over 75, really need to know about this potential arrhythmia.
Okay, and what about the older concern, the one people often bring up, bleeding risk, especially mixing fish oil with blood thinners?
Yeah, that's been a long-standing question, and honestly, the picture is a bit murky. It's true that very high doses, like 2 grams up to even 15 grams a day, might theoretically affect platelets and slightly increase bleeding time.
But does it translate to actual dangerous bleeding events?
That's where it gets complicated. The official package inserts for the prescription products often say that the studies didn't actually show clinically significant bleeding episodes.
Meaning not a big wave of people ending up in the hospital for major bleeds.
Exactly. But there's still caution. The FDA suggests periodic monitoring if you take these high doses alongside anticoagulants. And one meta-analysis did link EPA monotherapy specifically with a higher risk of total bleeding, even if not major bleeding. So the potential seems to be there, maybe for more minor bleeds, but the risk of severe events seems lower than perhaps initially feared if it's monitored properly.
So it's about balancing benefit and risk for the individual patient. Okay, let's shift gears a bit from heart health. What about the other big claims? Pregnancy, cancer prevention, brain health. Are omega-3s the miracle cure there?
In a word, no. The research in these areas is generally far less conclusive. Benefits tend to be either very specific, very localized, or frankly just not consistently found in large trials for the general population.
Okay, let's start with pregnancy and baby development. DHA is definitely important there, right? Concentrated in the brain, the retina.
Absolutely critical. DHA accumulation is massive during pregnancy in the first couple of years of life. And this is one area where there is a very positive and specific finding from RCTs. Long-chain omega-3s, especially DHA, significantly cut the risk of preterm birth.
How much?
About an 11% reduction overall, and even more impressively, a 42% reduction in early preterm birth, like before 34 weeks.
Wow, a 42% reduction in early preterm birth. That's genuinely huge for maternal and infant health.
It really is. And that's why you see strong recommendations for pregnant or breastfeeding women to get about 8 to 12 ounces of low-mercury fish per week, or perhaps consider a supplement, maybe an extra 100, 200 milligrams of DHA daily. But it's important to note, outside that specific preterm birth benefit, trials haven't consistently shown that maternal supplements boost the baby's cognitive function or vision later on.
Interesting. Okay, what about cancer? You see fish oil marketed sometimes as anti-inflammatory, maybe preventing tumors.
Yeah, the biological theory sounds plausible, but the large-scale human data, it just doesn't show a consistent link between omega-3 intake or supplements and overall cancer risk. You look at that big vital trial again, 1 gram a day of EPA plus DHA for over 5 years. No significant reduction in overall cancer risk or in the risk of common cancers like breast, prostate, or colorectal.
Which brings us to that confusing finding, the prostate paradox. Didn't some studies suggest high omega-3 levels might actually increase prostate cancer risk? That sounds worrying.
Yes, that definitely caused some alarm. It's a perfect example of why correlation isn't causation. Some observational studies did find that men with higher blood levels of these long-chain omega-3s also had a higher risk of high-grade prostate cancer. The initial fear was, oh no, are the omega-3s causing it?
Which would completely flip the script on them being healthy.
Right, but it's been heavily debated. A leading alternative explanation is that the causality might be reversed. It's possible the cancer itself, the disease process, actually ramps up the body's own production or retention of these omega-3s. So the cancer leads to higher levels, not the other way around.
So the high levels could be a marker of the disease, not the cause of it.
Potentially. It's complex, and research is ongoing. But for now, the big intervention trials like VITAL don't support the idea that taking omega-3 supplements actually increases your cancer risk.
Okay, that's reassuring. Finally, the big one for many healthy adults, the brain. Cognition, memory, preventing Alzheimer's. This is a huge selling point.
And it's probably the area with the biggest gap between popular hope and, well, the hard clinical trial data. Observational studies, yes, they consistently show people who eat more fish tend to have lower rates of dementia later in life. That connection seems real at a population level.
But when you actually give people supplements...
When researchers isolate omega-3s and give them as supplements to healthy older adults, or even to people who already have Alzheimer's disease, the supplements just do not seem to affect overall cognitive function.
That's honestly so disappointing to hear, because millions of people take these specifically thinking they're protecting their future brain health.
It's a tough message from the data. The only glimmer of hope, maybe, is that in people who already have mild cognitive impairment, not full dementia, but some noticeable decline, omega-3s might help with specific things like attention or immediate recall. But for the average healthy person wanting to prevent cognitive decline, the robust trial evidence for supplements just isn't there.
Okay, we've covered a lot of ground, from triglycerides to AFib to brain health. Let's bring it all home. For the listener wondering, so should I be taking fish oil? What's the final evidence-based synthesis?
I think it really boils down to knowing why you might take it. Are you using it as a general wellness tool or as a specific medical treatment?
Give us the key takeaways based on everything we've discussed.
Okay. If you have diagnosed hypertriglyceridemia, high triglycerides, then yes, high-dose prescription omega-3s are an effective therapy backed by strong evidence, particularly the EPA-only versions if your levels are very high or if LDL is a concern. But remember,
it's a drug.
It's essentially a drug at that dose. And because of the dose-dependent AFib risk, it absolutely needs to be done under a doctor's supervision and monitoring.
Right. And what about for the generally healthy person, maybe just looking for primary prevention, stopping heart disease or cancer before they start?
For that group, the evidence for taking standard over-the-counter supplements is, well, it's inconsistent at best and, frankly, often weak. Those large trials just haven't shown a clear benefit against major heart events or overall cancer risk for the general population. So for most healthy people, we really come back to the food first principle. Meaning focus on getting nutrients from whole foods first. The dietary guidelines emphasize this. Eating fatty fish gives you not just EPA and DHA, but also vitamin D, iodine, iron, selenium, a whole package of nutrients working together.
In their natural form.
Exactly. So if you're generally healthy, aim to eat fish a couple of times a week rather than relying on a capsule to do the job.
So we started thinking about this simple, almost magical golden capsule. And the reality is far more nuanced. It's a powerful, targeted therapy, but mainly when used like a pharmaceutical high-dose prescription for specific conditions.
Precisely. Perhaps the most profound effect isn't this vague idea of general prevention, but rather the very specific dose-dependent way these fatty acids interact with inflammatory pathways and lipid metabolism. It's really a pharmaceutical story hiding in a supplement's clothing. And knowing that difference, well, it changes how you should think about that bottle in your cupboard.
A really crucial distinction. Thank you so much for breaking down all that complex data for us.
My pleasure. It's important information to get out there.
If you found this deep dive helpful, please do subscribe to the channel and maybe share it with friends or family who might be wondering about fish oil too.
We look forward to seeing you next time on What the Study Says.